everyone. I'm Hartford Health. Recently, you've noticed we've been crisscrossing the state, going to all of the hospitals as part of Hartford Healthcare system. We want to show you, give you an inside look at just how safe the emergency departments are across the system. Today, we are happy to be here at Charlotte Hungerford Hospital, and I want to bring in Dr. Anuj Vohra. He is Chief of Emergency Medicine here at Charlotte Hungerford. The entrance to the emergency department.
Where we have a trailer, and when any symptoms that could be consistent with COVID, fever, cough, shortness of breath, nausea, vomiting, and so on, we'll screen you here and we put you into a separate area where we care for COVID patients. If you do a screening and you're negative, we bring you into our emergency department and you're immediately roomed into a private room, so you have complete and dedicated privacy to ensure hygiene and personalized care. And we take every precaution out there to ensure that we are at the highest hygiene and standards to minimize any risk of infection. And we've done a wonderful job with it. I would say that we're essentially a COVID-free ER.
And we're going to actually take an inside look to see everything and how the staff is protected and what you would expect if you were to come here inside the emergency department. So we're actually walking through the main entrance here. So if I'm coming in, I'm actually going to be greeted by Allie Bauer.
Around anybody with COVID, if you've been tested and positive in the past 2 weeks, if you have any of the symptoms, cough, fever, nausea, vomiting, diarrhea, loss of taste, loss of smell.
And now, if I answer yes to any one of those questions, also you're going to be taking my temperature,
Yeah.
Correct? Okay. Now, if I answer yes to any one of those questions, you're going to direct me outside to the COVID triage tent, correct?
Yeah, I'm going to take you around to the back entrance.
Okay. Now, if I say no and I'm here because I'm having chest pains, what's going to happen next?
So next you're going to go over to registration, and then you're going to go into the triage, where they'll screen you and take your vitals and all that.
Okay.
I want to add on a few things, Tina. You'll notice that before you had your temperature checked, Allie cleaned her hands.
Yes.
So we make sure that we sanitize our hands, we make sure we have gloves on, we make sure you don't have a fever, even if you don't have symptoms. People should know that sometimes you may not have symptoms that are consistent with COVID, but we still check everyone's temperature to make sure there's no risk of infection to anyone else.
I notice she has her mask on and her eye shield as well.
Yes, exactly. So she takes precautions to ensure she's not infected and to make sure that she doesn't pass anything on to the next patient that comes in.
Okay. So we're done with Allie. We've answered no. We're coming in. We walk inside. Thank you, Allie.
And one more piece I want to mention, Tina, is even if you're not coming into our hospital as a patient, you still get screened. That means visitors or just anyone that needs to use the facility for any reason gets screened to ensure that we are COVID-free.
Okay. So we are now standing inside of the waiting room here at Charlotte Hungerford Hospital. Thank you for talking with us. We've seen Allie Bauer. We've registered. We're all set. I'm coming in here to see you. What happens next?
So my job is as a triage nurse, or whoever. Mostly you'll see me here. On other shifts you'll see other RNs. There's always an RN here. My job is to quickly take your vital signs, assess you quickly, and decide what room you need to go back to in the back. So your visit with me will be very short. The details of your illness would not be discussed here. It's just your vital signs and a quick assessment and get you back to the room where you belong to see another provider and also another nurse. And I do that by announcing you to the area so everybody's aware that you're coming back. After you leave here to go down to be assessed by the provider, my area will be cleaned and disinfected after every patient. I do that by using these wipes, wiping down everything that we use, the blood pressure cuff, the pulse ox, the wheelchair that you sat in, and then I'm ready for the next patient.
And you have to allow time for this too. You've got to build in that time to sanitize everything.
Correct.
Talk to me a little bit about that process.
Out here we're a little bit more, we have the wipes, which is a 1-minute contact. So that is 1 to 3 minutes. The area has to be wet and stayed clean and wet. And So that's what we use out here at triage because we're doing it so often that it's not like the stretchers. They have a different cleansing time period out there.
All right, Denise, well, thank you for showing us through this process. So once we get to the room, so Dr. Vohra, let's circle back now. So this is for patients coming in, but let's talk about patients suspected of COVID. Sure. So let's actually take a walk back out and go through the COVID tent where we're going to see how that part of it works.
Come to our emergency department, our average wait time is less than 10 minutes, which means you come in, you check in, you have a 2-minute triage process, and you're roomed. Our waiting room is empty, so you're not going to be exposed to anybody else. The people we see there are just hanging out, but we have 0 patients in the waiting room, and that's our goal. We want you coming in safe, we want you leaving safe, and when you come to our department, it's important you know that you're going to leave healthier. And we want people to feel safe knowing that we take safety extremely seriously, and we have a great throughput process.
Well, I do want to mention, though, as we walk outside here, that it is so important that if somebody is experiencing chest pains or perhaps a stroke, time is brain. Inside.
Yes, absolutely. The more time you delay any illness that you feel you may have, the higher risk you have of death. Death simply is something that we're trying to fight in the emergency department. So if you have any symptoms of concern, whatever they may be, we're here for you. We'll get you in quickly, we'll get you seen safely, and we'll get you where you need to be.
Perfect. Okay, so we're walking over now to, this is a completely separate trailer that was erected early on in COVID. So we're going to just walk up the stairs here.
And
so
I do want to show also, we're already prepared for another potential surge that may come. And you'll see we've already have spaced areas should we get a surplus or surge of patients, so they know exactly where to stand as they prep it to come into our trailer that's for COVID potential patients.
Got it. Okay, so we're entering here now, and we can enter here safely because there are no patients inside. I do want to stress that. So we're going to come around. This is obviously temperature controlled. All of the rooms are separated.
Correct. All separate rooms. And therefore you are minimizing any risk to anyone because you have your own dedicated space. Also important to note that in our emergency department, we do not use hallway stretchers. So you will always have a clean, sanitized room for yourself.
And now, if you come in here, you're going to be greeted by Cigar Rana. He is a physician's assistant. And if you notice, Cigar is in full PPE, that's personal protection equipment. Cigar, thank you for joining us.
No problem. Thank you. Yes.
So tell us exactly what you have on here.
Sure. So when we're seeing patients who are suspicious of COVID-19-like symptoms, we're wearing a full gown. We have gloves on. I have an N95 respirator mask.
That's actually underneath your mask.
That's underneath my surgical mask. So we're double masking, and we have a full face shield in patients that we're taking care of. So.
And gloves and the gown.
Correct.
So if a patient, Dr. Vohra, is coming in here, I do want to point out all of the rooms, they're 6 feet apart, they're all separate. What happens in here?
And here we'll take a look and evaluate patients and assess if they need further care other than being diagnosed with a potential COVID illness. From here, we may discharge patients to go home if they're safe to be discharged, or if they require higher levels of care, we'll bring them into the acute area of the ER.
But completely separate, once again. I want to emphasize that.
Absolutely completely separated. We actually have a COVID critical area in our ER and a complete area of our ER that's non-COVID. So if you have no risk of COVID, you're in one separate area of the ED. Even though you have your own private room, you have your own private entire section of the ER.
So never a chance of crossover.
Exactly.
Okay, but just, we really appreciate the tour today. I think it really is impactful for viewers to actually see how safe it is here and the precautions and the measures that are in place. What is your final plea for the folks out there watching in terms of emergent medical situations?
Sure. If you use our services at Charlotte Hungerford Hospital, you're coming into an emergency department that's very safe, that's going to heal you and make you feel better, and you do not have to worry about contracting any type of COVID or any other illness. We're here for you. We want to make you healthier, and you'll have a great experience while you're here with us.
Dr. Anuj Vohra, I appreciate the tour. Thank you so much for all of what you're doing throughout this health crisis. and continued wellness too. We appreciate it. And as always, thank you for watching us out there. I'm Hartford Healthcare's Tina Varona. Be well.